I incorporated being chair into the portfolio in many different aspects of the CAP binder. First being in evidence-based practice, using all of the policies and procedures that need to be updated into the portfolio of that. And then also some of my skills and competencies, just being the leader of nurse practice and managing the entire council and all the emails and meetings that go into that. One of the reasons I became interested in getting certified in gerontology is that the floor that I work on, the medical floor, has a lot of gerontology patients, and I thought Bellin offered the certification, that it would just be a good step to continue my education for that floor. One of the exemplars that I wrote for nurse practice, I had cared for a patient many times before in the hospital. This time we just knew was a little bit different. She was nearing towards the end of her life, and the previous visits she just wouldn't give up. This visit was a little different. She started to have a little bit of a panic attack, I think just knowing that she wasn't going to make it home. So I spent most of the morning just sitting by her because she didn't want to be alone. And I actually found out that one of the reasons she didn't want to be alone is because she was the safe haven for her children who have been abused by their father in the past. We took the time out of the morning and we wrote letters to all of her children, all 5 of her children, and then we sealed them in an envelope. And when they got there, we gave that to the patient's actual daughter-in-law to give to all the rest of the family once the patient had passed away. Sometimes as nurses, we don't always stop and appreciate all the little things that we do. We look at the big picture of just getting the patient home and being safe there, but it's sometimes the little things that we do, whether it's just sitting and chatting or holding their hand or giving them a hug, or in this case, writing a letter to their family so that they knew everybody was taken care of. I would encourage people to become part of the Nurse Advancement Program because it gets you involved in a lot of different things. It opens up many doors for you. Once you're in, people recognize that you're part of the CAP binder, and they reach out to you to help with furthering the support of the nursing system.